This is Business Under Fire, and today we have Dr. Mark Haverkorn here from, what's the name of the dental practice?
River City Oral Surgery.
River City Oral Surgery.
Yes, sir.
And we're going to have fun with Mark today because of a previous guy that I knew that my dad rode motorcycles with. Is Mark has quite the resume in front of his name. He's not only a DDS, he's an MD, and then does, how do you...
Yeah, nobody can do it.
Nobody says this.
Yeah, maxillofacial.
Maxillofacial, which is that reconstruction?
Yeah, it just means the face, maxilla, the face. So, normally you think dentistry, jaws, but this also means up around your eyes, your forehead, and all that.
So in a nutshell, will you describe the capabilities of what you can do to the human face, basically from the chin up?
Well, so in residency, we talked about from the pleura to the dura. The pleura covers the lungs and the dura covers the brain. So between your lungs and your brain, we can figure it out. Now, I'm not an ear guy. I will say that. I'm not going to help your ears.
So any type of illness, construction, describe some of that.
Yeah, I have probably done or seen pretty much any of the surgeries through there. I'm not an expert in all of them. I'll say that freely. So starting down low, thyroid, parathyroid, trachea, airway stuff, coming up higher, submandibular, like salivary gland problems, jaw problems. I did cosmetic surgery. You want a facelift, you want, that kind of stuff. I know how to do it. I've been trained in it. Not my favorite. I don't really do it anymore.
Yeah.
And then obviously mouth stuff, I'm a dentist. So anything in the mouth, tongue, back of your throat, cleft lip, cleft palate, can do some sinus stuff. The ENTs are better at that than I am, but I can do it. Nose, nose job or whatever, that's fine. Orbits, facial reconstruction. So the birth defects, or just people's faces off, we can fix that. And then up to the forehead.
That is,
and cranial reconstructions too. So you see the kids that wear helmets in the stores. HEB. Some kids got a helmet on. And what they're trying to do is reshape that head, and some of that can be done just with a helmet, but some of it needs surgery, and we can do that too.
I was reading in National Geographic, probably in 7th grade, so that would have been 87, of a tribe that actually puts, an apparatus on their kid's head. How long on a child's head could you actually manipulate the skull with some type of compression?
You've got probably until about 1.5 years that you could do that. So you got to do it early. But yeah, you can, the old Chinese bound feet thing, you see the African tribes that stretch the neck, which what they're really doing is just pushing the rib cage down. But yeah, all that can be done.
How many years have you been in practice doing this?
Man,
you're a year older than me, actually.
Oh, yeah. 70, I was born in 79.
Yeah. So anyway, sorry to interrupt.
No, it's fine. I finished residency in 2009. So summer of 2009 is when I got out on my own. At
30 years old.
Yes.
So I read this morning, I was with Mark. I don't have to go stalk Mark because, or Dr. Haverkorn.
No, it's fine. Call me Mark.
Because my dad is, he's a toothpaste pusher, or
I'm going to use that.
He's an oral health care guru, and his passion sticks out with it as well. And, and I like seeing it, but and like I told you, when you come on here, he sees hundreds of offices and he brags about 2 of y'all. And I really think he's been in dentistry for 50 years. And so the whole point of me getting this is I did start looking at your resume and reading it, even though I've heard plenty. And Dr. Haverkorn is a self-proclaimed nerd.
Yes. Yeah. My kids would vouch for that too.
And it even says on your website that you were on the math team.
Oh yeah, man. So Saturdays, here we are Saturday morning, I'd be on a bus with a calculator, practicing my skills, going through some science flashcards, getting ready to compete, baby. We were going to win. Take them down.
What kind of math did they compete in? And was it timed?
Yes. So there were three. A standard event had 4 tests. One was science, and the other 3 were math. And so you had number sense. You got 100 questions, 10 minutes, answer every question you can. You cannot write anything anywhere on the paper but the answer. Any little scratch mark or little, let me just carry the 1 here. Wrong. Yep, it's crossed off. And I wasn't the best at that. I was pretty good at it, but I never in 10 minutes could do all 100 questions because these were pretty hard.
And what grade were you competing in?
I started in 4th grade.
And what was the level? Do they have the math that based on your age?
Yeah. So the test is the same, that 10-minute test, but it gets harder as you get older. You know, start throwing a little calculus on there in high school. And yeah, I mean, I was okay with that, but not the best. And then they had that calculator contest, and they had a general math contest, which was more like a test you would have taken in high school. You get an hour, you can use a calculator, you can use scratch paper. Just how good can you do?
Dang.
You know,
I was never really good at math. I'm good at simple math. I can tell you how many feet it takes an airplane to land with all of these variables, but the actual scholastic math.
Well, so I could not do calculus right now. And you know how many times I've used it in my professional life?
Zero.
Yeah. That was just a way to screen people out. That's all that it was.
Well, they screened me out. They're like, get over here, Tom. Yeah. You're going to go run your head into the wall, and then Dr. Haverkorn is going to have to fix you up later.
Man.
So, and then your dad was
he was an oral surgeon. So kind of like, you know, your dad was a dentist, my dad was an oral surgeon. And that's kind of how I got into this. And I probably went to his office while he was working 3 or 4 times in my whole life. Mm-hmm. Go there on the weekends and like pull weeds and stuff.
Yeah.
But, so I didn't even know that much about what he did, but I knew he had a good life and he worked with his hands and did science stuff. And
do you think that the reality of sitting in a chair and leaning over people's face and mouth is actually taught to you about like what being a dentist is? Because y'all guys are laying over there all day long. Did you think about that? Or were you just thinking, I want to be a dentist, I want to be a doctor?
I thought I want to do surgery. And then I had to decide, do I want to go to dental school or medical school, you know? And, I couldn't decide. And then my dad said, well, you know, a lot of the oral surgeons today, they just do both. And I was like, oh, well, that's the answer. I'll just do both. Go to school even longer.
Isn't it crazy how naive you are when you're making these big decisions?
Yeah.
I'm watching it with my 17-year-old daughter right now. Like, oh, I want to go to this school. I want to go to that school.
Oh, we're going through that, yeah.
And they don't. I thought I was a little bit smarter at 18, that I'm looking back at my kid going, she doesn't have a clue.
Yeah, we're going through some of that now, and it's funny. I see a lot of teenagers taking out wisdom teeth, and so a lot of them are seniors. And I'm just curious, and I just ask them, "Hey, what's next? What are you doing next year? What's coming?" Mm-hmm. And man, it's you hear some really good stuff, and then you hear some stuff you're like, oh boy, you know, I want to go to college. Oh, what degree are you going to get? Psychology. What are you going to do with that? I don't know. How much is it going to cost? A lot. How are you going to pay for it? I don't know.
Yeah.
Oh man.
I deal with it up in Lubbock a lot because I've got the 2 restaurants at Texas Tech with busy college, and you run into all these guys and girls, and they get there, and some of them are happy. Some are like, man, this is just not for me. What should I go do? I'm like, man, I'm a lawn guy that owns bars and restaurants. You're asking the wrong dude.
My wife and I are really involved in the ag area, like FFA and 4-H, and our kids are involved in that. So I talk to a lot of those kids, and I mean, you know, a lot of the boys don't show up, at least at our school, to be the officers and the book stuff. But you go over to the welding shop, man, and they're at it.
Yeah.
You know? Well, that's fine. That's a great career, you know? And I mean, I'm sure you can get into it more, but like, you don't want to be the general welder. You want to be the specialist.
Yeah.
I went to med school with a guy that spent several years as an underwater welder in Louisiana. He paid for his college and med school in cash with the money he made. So he was the old guy, 'cause he was like 28, you know, or something. But yeah, the specialized guy making some money.
Yeah, man, it's Life can take you so many different directions. Yeah. So you decided that you had a conversation with your dad and you go, well, we're just going to do both.
Yeah. It was very nonchalant. Just, okay, I'll just do it.
Where did you end up going to school?
So I went to University of North Texas up in Denton, and then came to dental school here in San Antonio. My dad had gone to dental school in Houston. And so I thought, I'll be a legacy. I'll get in Houston. And I did, but it was a couple months after San Antonio said yes. And I jumped on the first yes. I didn't know anything about San Antonio. And it was great. And Houston's a good school too. So I did my dental school here, and then you got to do a residency. And for oral surgery, if you want to get the MD, most of those are 6 years. There's a couple 5, and it's been a while since I looked at it, and a couple of 7 year. 7 year was out. I was like, no way I'm doing 7.
Yeah.
If I can do 6. And 5 didn't seem like enough when you break it down to how much time you get. So, and then it was, okay, first off, who's got the best training? And then secondly, like, what's the least amount of time I can spend in medical school and get my degree?
And then when you finish medical school, where does a guy go?
Well, so the way it worked in my program, you showed up, you spent a year just doing oral surgery. And what that meant, you were the intern, you were the grunt.
What does oral surgery mean for people who don't know?
I mean, it means all the stuff we talked about, neck, face, all that. But as a first year, it means you're in the clinic where you almost never see, you're the boss, and you're just pulling bad teeth all day long.
Yeah.
And, like, if you're lucky, please, sir, may I go to the OR and watch a surgery, or big surgery. And you got to do that some, but the first year, man, you're just pulling bad teeth.
All day.
In a community clinic. Yep.
How long does it take you to get a tooth out now?
Oh, now less than a minute on an easy one, But back then, there were many 1 hour extractions.
Oh, really?
Oh, yes. Yes.
Were you feeling bad when you were first starting? What was the first extraction like?
Oh, man. I don't even remember the first extraction at that clinic, but just, you show up and you think like, yeah, I'm an oral surgeon. And you're the intern, but you're like, yeah, I'm the oral surgeon. And then you get that one, and, an hour and a half later, your co-resident's knocking on the door like, hey, are you alive in here? And I got an assistant, and the assistant's like, here, you want to try this one, and hand you a different instrument.
God.
Yeah. I mean, the nice thing was it was in Louisiana, that was free. And so
they have teeth to work on in Louisiana.
They have a few.
See, I just learned that.
Yeah. So the patients got free extractions. We were licensed dentists. We were legitimately dentists. We were not harming them per se, but it wasn't the slickest work you've ever seen.
Man, that'd be finessing your craft. I don't know how long it would take to learn to get a tooth out, but there's so many angles in the mouth.
Yeah.
Are you kind of going for the exact same spot on the same tooth now?
Yes, that's a good way. Yeah, you start to just recognize the patterns, right? Okay, this tooth needs this tooth needs that. And patients come to me all the time. Oh, my dentist says this is going to be hard to get out. Look at the roots, look at this. And I don't even look at that. Which tooth do you need? Okay, let's do it. But like, I don't know. I would assume you could do it with the airplanes. You get in an airplane and like, okay, let's fly it.
Yeah. One thing that was mentioned to me, which is crazy, is my dad has pulled probably millions of teeth as well. And I talked to him about it, just kind of like we are today. And he said that the African-American males' teeth do not want to come out.
So, and remember, I went to school in Louisiana. So that's what I learned on. And they are sometimes tough, man. And it's a known thing. I mean, all the dentists will tell you. And the black dentist, everybody knows.
Isn't that crazy, the human body?
Yeah, there's just different types of bone, and they have what we call type 1 bone, and it is just harder to get the teeth out of. It's so funny. I had a African-American patient recently, this lady, and she came in, needed a molar out, and it was so funny. She asked me about that. She said,
she did?
Oh, yeah. She said, now look, I've heard that this is going to be harder.
Oh.
And I said, well, I went to school in Shreveport. And she goes, okay, you're going to be fine. it was fine.
What an interesting thing to learn.
Yeah. So one of my assistants I worked with for a long time, I really liked, was a black lady from Panama. So Spanish was her first language. First off, so nobody expected the black lady to speak Spanish.
Yeah.
So she could spy on these conversations and tell me what they said.
Yeah.
But whenever an African-American patient would come in, she'd go, "These are one of my people. You're going to pay." And then she'd get so mad if I could take it out fast.
Oh, yeah. So you said that you were getting a referral from a dentist at your practice. I wish I knew how to mute that. River City Dental, right?
River City Oral Surgery.
Now I'll get this right.
Because River City Dental is actually a dental practice, and it is not me.
16.
They're not bad, but it's not me.
I'm gonna tell them to take that out so we sound right.
Okay.
So at River City Oral Surgery, you're not seeing the patients for teeth cleaning. You're not seeing them for. You're not putting bridges on.
No. I tell the patients, I'll pull your tooth and I'll replace it with a dental implant. But in the dental world, that's about what I do. You know.
I'm glad you just said that because somebody lost their front tooth. So what does a typical case look like that walks into River City Oral Surgery?
So about half of them are self-referred. They just heard about us through marketing. The other half were sent by a dentist or an orthodontist or somebody. And a lot of what we do is just taking out bad teeth, even still. So it's, we do the wisdom teeth and all that, but a lot of it's just somebody's got a bad tooth and it looks like maybe it's a little challenging. Or the other thing is maybe it's an easy tooth, but they're medically kind of more complicated. And so the dentist doesn't want to have to fool with that. So they come in, we talk to them, get an x-ray, tell them what's going to happen, confirm the plan, pay the money, come to the back, take the tooth out, let them wake up, and then they go home.
So you're doing your own anesthesia as well?
Most of the time, but in the last 3 years, I've started hiring a medical anesthesiologist that comes in and helps me, and man, it's been great.
Holy crap. I don't know if people that are listening understand the amount of specialized medicine that you do as opposed to just one specialist. It's insane.
So, I mean, it's cool to hear you say that because it's just my daily work. I don't think about it much. It's just what I do.
Okay, but if I need to go to if I need to have a tooth pulled, they're going to say, well, go to the dentist.
Right.
If I need to get put to sleep, they're going to say, okay, well, you need an anesthesiologist.
Yeah.
If I need my nose worked on, they're going to go, you need to go to an EMT.
Right. Yeah.
If my jaw's messed up, they're going to say, well, you could skip all this BS and just go to Dr. Haverkorn.
Yes.
That's a lot.
It is, but there's almost too. I can't do it all.
Yeah.
And so you almost have to kind of figure out what is my niche, what am I going to do, and sometimes I feel bad because maybe I'm not practicing at the limits of my training, and where I trained, we did lots of cancer surgery, and I rarely do that now. And sometimes you think, man, I should do more of that, but.
What is cancer surgery?
So mouth cancer, tongue cancer, throat cancer, so you got to go in there and cut the tumor out. Sometimes you cut off part of the jaw or the upper jaw. You got to reconstruct that. You can use like leg bone to do that. You can use the skin off the forearm.
Can you take leg bone or skin off the
Yes.
Holy shit, Mark.
Yeah. Look, I'm not now. I don't do it all the time. There are guys that do it more than me that I know are better than me. But yes, I know how to do it, In your office, what are the capabilities for surgical needs in the office? Do you have an operating room or is it more of a dental chair? It's a dental chair in a room, but it doesn't look like what the typical dental offices look like today. I mean, a lot of dental offices today are open bay, so there's chairs lined up, or they'll have a treatment room with either an open door or the sliding door. Ours is more like a medical office. You're going to go in the room and we're going to shut the door. Yeah. Total privacy.
Yeah.
And then we have 3 rooms that we do our surgeries in. They're all outfitted the same. One's a little bigger than the other, so we do the big cases there. But we can put the anesthesia machine in there, like the anesthesiologist I was talking about, for a big surgery. Puts them to sleep, and we're doing jaw surgeries now. Orthognathic surgery is what it's called, where you move the jawbones around. So think of like Jay Leno with his chin out. You can fix that, and we're doing it in the office.
Holy crap!
Yeah. And then the surgeries where you replace all the teeth with dental implants. I'll take out, I'll do some neck surgery. I'll take out some salivary glands and stuff in the office. But there is a threshold at some point where you're like, this needs to be at the hospital.
What, and that's what when you were saying that, I was going, what is the threshold? And then do you do operations in the hospital?
Oh yeah, I'm at the hospital all the time. The threshold would be, first off, medical stuff. So is there just some reason why this patient shouldn't be treated outside of the hospital, bad heart or whatever? And then just a more invasive or longer surgery. So if somebody's going to be in surgery for hours and hours, they probably should have a little time to recover, maybe spend one night in the hospital. Kind of depends on the specifics. So those patients, or patients where you're worried about maybe like post-op swelling that might make it, if it goes really bad, it might be hard to breathe or something. So we want to watch them, Fortunately, I haven't had to deal with that. It's no for the world, but you do, that would put you in the hospital. Are
there cases that you decline because of all of the symptoms that they have and possible?
No, so that's might be part of my niche in the marketplace. There's no medical problem that I'm going to turn away, and there's no age group that I'm going to turn away. The only thing I don't do cosmetic surgery, and I've been trained on that. And I don't do a lot of the jaw joint surgery, the TMJ problems you hear about, people saying, oh, my jaw pops and it hurts and all that. I just don't do much of that.
Is that because the recovery on it and getting it perfect is not easy? There's so many moving parts right here.
Yeah, that's part of the problem is, the results are, they're good, but it's funny. If you got a bad knee, you're going to wear a brace, you're going to get some injections, you're going to try, some different injections and let's see what works. And eventually you may get a knee replacement. Most people kind of know how that goes and they kind of expect it. But a lot of the patients that come in with the jaw joint problems, they think I'm going to fix it like in 1 or 2 visits. And they think the insurance is going to pay for all of it. And neither is true. And I don't know why. I don't know what the disconnect is. And so it's just, a lot of times it's just hard to win in those cases.
Yeah.
And then and so you do some stuff and they're not happy and then it becomes a little bit of a tense relationship sometimes. And then replacing the jaw joint is a little bit of a tricky surgery. I still do that surgery because when people break their jaw up there, I go in there and I fix it. So I don't think it's the surgical difficulty per se. It's just, it takes a lot of effort and there's not a lot of profit in it. And
what is a case that you get satisfaction out of, or tell me about a case that you put somebody back together that you're just like, man, this just came out great?
Okay. So for the second thing, the very first case in private practice, 2009, I'm getting out of school, show up in Fort Worth, Texas. My new boss says, I've been waiting for this case. And you think, okay, what's up? And it was a self-inflicted gunshot wound. And it's about 1 year old. So the guy's gone, he survived. He's not suicidal anymore. And he's pretty, happy with life. And he'd gone through initial reconstruction, but he needed more. His lower jaw wasn't right. His upper jaw wasn't right. He had a hole through the roof of his mouth up into his nose. And we took him to the OR and did a long surgery and fixed it all, and he still has, it didn't look completely normal, but man, he looked better. And all the jaws lined up, the holes closed, he can eat, he can drink. So that was really cool.
Dang.
So I'll remember that, just because also, like I said, it's the first big case I did right out of residency. And then I think the other thing I like is fixing stuff that patients have been told, can't be better.
Who are they getting told that by?
Sometimes it's their dentist, sometimes it's their doctor, just people, and even sometimes it's another oral surgeon that just says this is the limit, and then we figure out a way to bump it up.
Golly. I guess that's a personality trait too of another oral surgeon that would say, this is just as far as I can go, and maybe in your experience you've seen it go a little bit more further, and you're like, nah, I've seen this before.
Exactly right. Yeah. And some of these guys know what to do, but it's sometimes it's taking a lot of time out of your office, and they got to go to the hospital, and I don't want to knock them all or act like I'm way better, but I'm just willing to do it.
Yeah. Well, I think that's what separates a lot of people in business under fire, obviously. But in your practice and in my life, I think that's what separates a lot of people is I'm willing to do it.
Yeah.
You're willing to do it.
Yeah.
You're willing to try. I mean, think about the thought of putting a scalpel on someone's face.
Yes.
You do it every day.
Yeah.
But if you told me, hey, Tommy, this is an easy procedure. I've got this right here. I just want you to cut it out.
Right.
And I'd be like, dude.
Yeah.
Oh, man.
I love reading about, watching videos about medical history, and you think like somebody did this for the first time.
Yes.
How did they do it?
Yes. Who was I talking to? Man, I was talking to a guy. Think about, and it doesn't matter the guy, but think about the MDs and the guys from the 30s.
Yes.
In the 40s.
Yes.
In the 50s.
Yeah.
I mean, you can take a good x-ray now, a great x-ray. You can run somebody through a, what's the CAT scan.
Yep. Not the.
And you know what's there.
Yes.
They didn't know.
No, they did a lot of exploratory surgery. Let's see what's up and then figure it out.
Exploratory surgery. So, helpful hint, folks. If any doctor says we're going to do a little bit of exploratory surgery, you say, we're going to wait. I don't like exploratory surgery, sir. Yeah. Wait, just start cutting right here.
Yeah. But you know, back in the day, belly pain, you made some pretty good guesses. That's probably the gallbladder's probably the appendix. And then you open it up and you're like, nope, it wasn't.
Oh, man. That'd be tough.
Yeah.
I had hernia surgery last week on Wednesday.
Oh, man.
They call that endoscopic.
Yep.
So, and I guess the old way that they did it was they cut around your belly button, peel back, put mesh in.
Yes.
And so I had a couple lipomas pulled out too, which if anybody has lipomas and they're worried about it, you almost don't even feel it now. The recovery is almost non-existent.
Nice.
But the hernia stuff is painful. Have you ever had that?
No, I've not had it, but I've seen it. And my wife's a urologist, and she would do some of that too.
It's just I was in bed literally and could hardly get up for 3 days.
Well, think about how much you use the belly muscles, and you talk, you laugh, you sit up, you move. Every time you're going to feel it. And
it's getting out of bed without having to use your elbows and your hands. I have this really cool rolling technique to get out of bed now, where you use no stomach muscles.
Yeah.
Or if the pillow is behind your head and you want to lift up your head without using it doesn't happen. You can't lift your head up to move the pillow. So it's a tender surgery. And I'm kind of the medical stuff up in Lubbock is so good.
Yes.
I'm friends with a bunch of the doctors up there. So if it's like, hey, I need this, they're like, okay, well, come here. We'll send you here. And it's zoom, chop.
Nice.
My belly button was just barely sticking out. And I was like, Jeff, what is this? He goes, obviously a hernia. And,
duh.
Yeah. I said, well, that's what I was thinking, but I'm not a doctor. I push lawnmowers. And so they did that. And I was also surprised on one thing that I noticed. And when I did go in, I said, no matter what on recovery, I'm just going to lay there and take it easy. Normally, I'm like, I'm just going to get up and whatever and fight it.
Yeah.
No, it was 2 to 2.5 hours before I even felt like doing anything. Is that extra long?
No, I think that's pretty normal.
Yeah.
I mean, that's my wife. My wife had some C-sections, and first one, same thing.
Yeah.
You're cutting the belly open and you feel it, buddy.
Man, so y'all are a family of MDs, huh?
Yes.
And she's a urologist?
Yes.
And is that is male and female?
Yes. So
bladder,
kidneys, urethra, all that, and then of course the genitals. And she said, I know that most of my patients are going to be women. So after she finished her urology residency, she did a 2-year fellowship in just female surgery. And so her practice was mainly women, not completely, but mainly.
Is she in the hospital or she has her own practice out?
So both. She was in private practice. Even she taught for a little while. She was in private practice for about 10 years. Had a clinic, saw patients, did surgeries in the hospital, in the surgery centers, all that kind of stuff. And then right before COVID happened, she said, kids are getting older. They kind of need me around. And she took a job working for United Healthcare. Just when your insurance company has a doctor look at it, she's one of them. And then COVID hit, and it actually turned out to be pretty good because her old group, surgery numbers took a nosedive for a while, and she got a steady paycheck there.
Good.
So yeah, and then she's doing that now and got a promotion, got a bunch of doctors under her now.
Cool.
Yeah.
So when you get out of, is it called residency?
Yep.
So when you get out of residency and you've got this fresh, newly framed diploma with your name when you saw that diploma, could you even believe it?
It took a minute, because you think, wow. And my med school and my dental school diploma are big, and my finished residency is like an 8.5 by 11 little one, and that's the most important one.
Yeah,
if you look at it, you're like, I don't even know. It's over. I've done school since I'm 30, and now I'm done.
And you get that fresh piece of paper framed, hung on the wall, and then where do you go?
Well, usually that last year or so, you start looking for what is coming. What am I going to do? And some guys decide to teach and go into academics and do research and all that. Other folks are in the military. Some people go to institutions, so you can work like for Indian Health or something like that. But the vast majority of us in all specialties go into just private practice. And that's what I felt like I was going to do. And I grew up in Longview, Texas, in Northeast Texas, and I love it. But my wife was not as excited to live in Longview, Texas. So
Where's she from?
So she grew up in Schertz and then went to high school in Plano.
Cool.
So, we do a lot of farm and ranch, like I said, and she's kind of a country girl, but she likes to be closer to the city too.
Yeah.
So I told my dad I'm not coming back, and he sold off his part of the practice, and I had to find something. And we wanted to be in Dallas-Fort Worth, so I just sent, more probably so the Fort Worth side, so I just sent, I think, an email to every oral surgeon in Fort Worth.
Be like, look what I got.
I was like,
check this attachment out.
It was more like, please, sir, can I have a job?
Yeah. Yeah.
So, and one guy said, yeah, I'm kind of thinking about it. And so I went over to Fort Worth, and that's where I started.
And you worked there for how long? This is usually where we go to with other business owners right now. How long were you working there before you got the itch to start going, I think I want to deal with all this BS on my own. I like stress.
So mine was a little more convoluted. I spent about 9 months there, and then I decided to go flip over to the Dallas side. So I worked for a guy there for like 6 months, and that didn't really work out. Tried to make a business deal, but this is right after the Great Recession. So money was hard to get. The banks are like, how much debt do you have? And yeah, you're a doctor, but we don't care. You're not getting any money.
Yeah.
So what am I going to do? And what's next? And then a guy from dental school that I knew called me from San Antonio. He's working at the VA. So I talked about institutional. He was working at the VA hospital in San Antonio. And he said, hey, we need an oral surgeon. Are you interested? And it's like, as a matter of fact, yes. So I thought, I'll move to San Antonio. I'll spend like 5 years at the VA. I'll kind of get my feet under me. I'll pay off our loans, and it'll be good. And man, after 2 years, I couldn't handle it.
On the VA working, and you don't have to give me numbers, but what is a halfway decent private practice gonna do versus you working on the VA? And you don't, is it a spread of like 300 grand or something?
No. So the VA salary for a second or third year oral surgeon was pretty dang good. Now for an experienced oral surgeon, no, not great.
Yeah.
But I was probably right in line with my peers, so that was attractive too.
Good.
Now I did know, I was smart enough to kind of look into it, and actually, I don't know if you still can, but back then you could, if you knew what to do, you could look up every VA employee's salary on the internet.
I think you still could.
Yeah, you probably can. So I started looking at what do all the old guys in the hospital make, and I was like, it's not that much more. So I knew the future was kind of limited, but it was okay.
My future was not bright.
Yeah. And I liked the patients there, and in my clinic, my staff were good, but the bureaucracy outside of that was insane, and I could not handle it.
Yeah.
So probably like, if you kind of got some of that do it on your own stuff.
Yeah.
And then you need 5 forms to get a bottle of white out. You just like.
Well, you can see that from what you said earlier about the cases that someone's not going to take. And you're like, no, I can push this a little further.
Yeah.
And then you got to do whatever you need for a damn pill. You're not going to be happy there.
Yeah. And I got there and I think they said, we see, 12 or 15 patients a day. And I was like, are you kidding me? We have a waiting list of 900. We're gonna. Those are rookie numbers. We need to pump those up.
And they just didn't care.
My staff helped me, yeah. But then when I left, the next guy called me and he's like, "Were you really seeing this many patients?" I was like, "Yeah, it really was." He's like, "That's too much. We're not gonna do it."
What else are we going to do? We're here to work.
Yeah. At noon, I would be in the OR doing surgery, 11:30 or noon, and the head doctor in the OR would come by and say, "Hey, Mark, you about done? We got to wrap it up." I was like, "I thought the staff was here till 3. Yeah, well, we just got to wrap it up soon." Man, coming out of residency where you would work 16-hour days and not think twice, it was something different. So after 2 years, I was like, out, sorry. And I actually thought I was going to go to Abilene, up towards that.
Abilene's a good spot.
Yeah, it is.
Well, then what did you end up doing?
So I thought I was going to go to Abilene, had a deal there. My wife was a little reluctant about it, but had a deal. And then my assistant at the VA had been in private practice, and she contacted the private practice group in San Antonio and said, "Hey, this guy's going to leave, and maybe you want to talk to him." And so they contacted me, and I got that job.
Nice.
And so worked out, stayed in San Antonio, spent 5 years there. They offered me a partnership. Great guys. I really like them. But that's where the itch came. You asked about the itch.
Yeah.
And I just had this crazy idea about how to run a medical practice or a dental practice that was real different. And they didn't hate it or anything.
Yeah.
And I said, okay, I'm going to go do that. Thank you very much for everything you've done and the partnership offer and all of that. I'm going to go do something really stupid.
And how long have you been doing this on your own now?
About 7.5 years. This is the longest I've done anything.
Well, you're into it now, but what were there times in the beginning of this that you were just going, man, maybe I should have just stayed. I kind of had it made.
Yeah. Oh yeah. There's times probably last week where I was like, what am I doing here? But I was fortunate because my wife made a good salary. We were going to be fine.
Yeah.
And so I could go over here and be the play and see what happened.
Yeah.
I could see the vision and I thought it was going to work. A lot of other people were kind of like, this will be interesting. My wife believed in me. She never told me no. But I know that feeling.
And I don't know what your circle is or who they are, but in my circle, and probably not great, but every time I tell people I'm going to do something, they say no.
Yeah.
They're like, dude, that's dumb. Why would you do that? Why are you going to do this? And it's hard as a business owner, entrepreneur type to get a yes, which I think that's why I hang out with people like the guy I was with yesterday. Yeah. He's like, yeah, dude, go do it.
Right.
Yeah, go.
Right.
But the world tells you no.
Oh, yeah.
And it's nuts.
For me, it wasn't necessarily no, but they're like, well, that's pretty, that's a good idea, but I don't, or that's interesting, or wow, but I don't know if I'd do it, or I don't know. Yeah. So
you saved up a little bit of money. You had to find an office building.
Yep.
And where's y'all's office located at?
10 and 1604. So we're opposite of Top Golf right there on 1604.
That's a good spot.
Yeah, it is.
That was, I got a story about that place. That was in the middle of nowhere.
Oh, yeah.
And there's a guy that used to pay me to go clear all of this land over there.
Oh.
And his name was Amin. He's probably still alive, but he's from Mexico. So he would have his secretary call me and say, Mr. Tommy, Amin would like to speak with you. And I'd go, well, put him on the phone. Yeah. So then Amin would answer the phone and go, hey, Tommy, how you doing? I said, why don't you just call? And he goes, well, blah, blah, blah. It's not how we do it in Mexico.
Right. I got my people.
Yeah. So then I meet Amin at this, Amin or Amir, I forget. He's a great dude and funny. I go meet him at this engineering firm to talk about this project we're going to do. And we're a tiny bit off on the money. And his phone case has a big Ferrari on it. And he has the keys to a Ferrari on the table. And we're talking, I said, we're talking about $10,000 or $12,000. Do you have a Ferrari? And he goes, no, just the remote control one. I said, let's meet in the middle and get this crap done. He goes, okay, let's go. But that was over there, and you're in a good spot. They developed that place. It looks wonderful.
Yes.
But sorry about my tangent. But
No.
what did that look like in the early days on getting an office? How did you know how to source the equipment? Who did you call?
I didn't. Okay, so first call I made was to a commercial real estate agent that I'd heard on the radio, and I kind of made a note, if I ever need a place, I'm going to call this guy. So I called him, and we started looking at spots and looked at several, and just kind of locked in on this place. I wasn't even sure how many feet I needed. How do you design an office? How big? And at the time, I thought I was getting too much space. And then common story. Now I'm like, I wish I had more space. We've all been through that. And then the next question is like, how do you get your stuff? Well, medical dental stuff ain't cheap. And man, I got so lucky. There was an oral surgeon in San Antonio. Don Test was his name. I got to give him a shout out. And he had practiced for a long time, had a good office, and he was looking to retire. And about 5 years before that, his office had burnt down, and this insurance company had bought him new stuff. And he just wanted to kind of offload the stuff and lock the door. He wasn't trying to sell me, $5 million practice.
Dang.
And he said, he cut me a really good deal on the stuff.
That's great.
And I just wrote him a check and I said, I'll take it.
Damn.
And I still have a lot of that stuff. I'm still using
great.
it. Yeah. Oh man, it was phenomenal. Because otherwise I was looking at way more debt to do it.
And on a ballpark, what does an office like that cost to set up?
So if you follow the practice advisors, right? Yeah. If you do all that, oh man. Well, let's put the real estate aside. You're going to probably spend easily $500,000 and probably closer to $1 million to outfit it.
Just in equipment.
If you want brand new stuff, yeah. If you get the whiz bang X-ray machine, you're going to spend $100,000 on that.
Yeah.
And your autoclaves are $15,000 a piece, and your dental chairs are $25,000.
Golly.
Yeah. So. And I was not interested in that.
Yeah. Well, that's good that you found it. And then when you get open, where do you find patients? I have a really good, I'll tell this story after you say, but where do you get patients?
Well, for a little while, there were tumbleweeds. There weren't a lot of patients.
Just sitting there with your instruments ready to go.
We were cleaning. That table was clean, man. That floor was spotless. So early on, I was still taking a bunch of call at the hospital. I had a separate contract. I was paid to take call.
That's a good idea.
So that filled me, that filled my days and helped me. And then we started advertising, did some social media stuff, and man, we would go to HEB and get trays of cookies, and we would just go to the businesses in the area and go to the dentist and go, here's some cookies. Would you send a patient?
Yeah.
And I remember probably a month after we opened, we got our first set of wisdom teeth. It was the son of a nurse I knew.
Yeah.
And we're doing the happy dance in the back. We got a wisdom tooth case.
That's awesome.
And and then just kind of built from there.
A ENT from Houston, he had a really successful practice. We were buddies. He lived on Lake McQueenie.
Nice.
And he loved North Carolina. He's from there, but he came down, did school here. And so he sold his practice in Houston, and he went to North Carolina, and he would come back to McQueenie every now and then. He's like, man, I couldn't get anything, but here's what I did.
Yeah.
And he goes, I took cupcakes and I delivered them at dental offices. I delivered them at doctor's office, and I'm taking $4 cupcakes and I'm getting $30,000 cases.
Yeah.
And the point of this story, and I haven't shared this on the podcast, but this is the perfect time to explain this. I made $1 million dropping off cupcakes.
Nice.
You made $1 million dropping off cupcakes.
Yep.
And you and I can go tell somebody, hey, go drop off cupcakes here or pizzas here or this. Yep. And they look at us like we're just idiots.
Yeah. I got time for that.
And when Mark came in here, I said, dude, if we tell one story that changes one person's perspective, as simple as this is, Mark, would you tell people to go drop off cupcakes and cookies?
Yes, absolutely. And somebody wants to talk to you, call them or call them back. Talk to them.
That's how simple it is. In my story with the cupcakes, and I dropped off pizzas at these commercial places that we mow. It took me 2 years to get them, but eventually they're never going to say no to pizza.
Right.
They're never going to. And by the way, if you really want the advanced level course, drop the pizza off at 11:40. They're hungry.
Yes.
They're not going to say no. But we were dropping off cupcakes to the Lubbock airport and coffee from my one of my coffee shops called Paint Rock Coffee.
Oh, I've driven by it.
So we were just dropping them off, and eventually the administrator said, hey, you don't have to drop anything off anymore. And when that airport went out for bid, they told the company, we're not telling you you have to. We're highly suggesting that you have Paint Rock Coffee in the Lubbock airport. And because of those cupcakes and dropping them off, I'm going to make $1 million off of it.
It's phenomenal.
And it's just a crazy, crazy way that this MDDDS guy is out here. We're all doing the same thing, and it's so simple, but people won't do it.
Have you heard that saying, people remember how you made them feel? Mm-hmm. You know, that's what it is. Like, they got to know you a little bit. They liked you. Oh, it's the pizza guy. And then look at it. You roll it into it.
Dr. Jubinville that was here before you, he came in from Tennessee, and he told me, he goes, you're an endorphin dealer.
I like it. I might steal that line.
You're an endorphin dealer, Tommy. You're dropping off candy, because I still do it. I drop off donuts everywhere.
Yeah.
But actually, I dropped off. I couldn't get out of bed last week, so I DoorDashed donuts places.
That's great.
Yep.
And I know your dad runs around and drops off stuff too.
Well, he learned that bad habit from me.
Yeah.
And I'm really not sure why I do it, but it's ingrained in me now. I just enjoy.
It's a small thing that people remember.
I just think that, first of all, I've never had anybody just drop off a pizza to me and be like, hey, man, how you doing? Enjoy the pizza. See you later. And we do that down in Port Aransas with businesses. We drop pizzas like crazy. And I just think the feeling on the other side, these guys where I drop donuts off, I drop them off at Burnt Bean Barbecue all the time. And those are my buddies, but their faces still light up after 4 years of dropping off donuts. Nice. And I like to hear from them. And so anyway, if you want to learn how to get some business, whether it be reconstructing someone's face, reconstructing their landscape, reconstructing a insurance deal, start dropping off food and saying hi. Yeah. It's that easy.
Yep. Get your foot in the door. Yeah. I like what you said too about just kind of no strings attached. They know who you are, but you're not, hey, can I meet the boss? Can I have 10 minutes of your time? Mm-hmm. Oh gosh, I get so many of those emails. Yeah. I just need 10 minutes of your time. No. You
guys, the medical community, y'all get bombarded with salespeople.
Medical side more than dental, or general dentists get probably more than I do. But I do get hit every week at least. Somebody comes by once.
Yeah.
And it's hard to get time with me.
Yeah. What would you say to somebody that was looking to get into the medical field that you're in? What advice would you have for them?
Like if they want to be an oral surgeon?
Yeah.
You know, I mean, there's a lot, we talked about calculus earlier. There's a lot of like hoops to jump through and just cuts that you got to make. And it's mostly grades. You know, and don't get in any major trouble. And everybody has a little different path. Oh, you got to do research, or you got to volunteer, or you got to do all this. And, you know, there's just a different kind of path there. But obviously, you've got to be pretty good at academics. Mm-hmm. And then I think what helped me, too, was just making some connections along the way, meeting some professors. And then I know for residency that I got into the residency I wanted to be in because I did an externship there 2 times and spent, like a month at that place, got to know the bosses and the people who were selecting the future residents, and tried to do a good job. And I didn't even know what a good job was, but tried to be eager and I know it worked, I applied for, usually when you apply to residency, you apply to a bunch of places and chips fall where they will. I applied to 1 and I got in.
Good for you.
So it worked.
What, and would you think it's going to take longer, be harder, more stressful? It's not going to be easy
to get in.
Yeah.
Yeah. I think it's funny, man. All the guys in medical school, dental school and stuff, you're just in this bubble and everyone is going through it. And you just think it's normal that 25-year-olds are like studying on Friday night or, you just don't even realize what the rest of the world's kind of doing at that age.
Yeah.
And so it is hard, but when you're in it, you just think it's normal.
Yeah.
It's
such an interesting, career path and thing to do, to go work on the human body, and you do it every day. One of my favorite quotes is, "Your reality is not my reality."
Yeah, I like that.
And because your reality is you're operating on these people's faces every day, like it's changing the oil on the car.
Yeah. I have to kind of remind my staff of that because we all get used to it. And people always say I don't like their doctor who doesn't talk to them and the staff's not warm and fuzzy. Well, because it is just changing. I'm going to do this 10 times today. But for them, it is a big deal. And you got to remember that.
Mark, tell me again, at River City Oral Surgery, what y'all do stuff different than any oral surgery place or doctor's office. Tell me what you guys do that sets y'all apart.
I got 3 things. We don't take any insurance. And then you immediately think that's expensive, but no, we set our fees to be reasonable. And the big one is our fees are on the website and we hand them out over the phone. You don't have to pay us for a consult to find out how much it's going to cost.
That is just nuts. How did you decide that you were going to do that? Because that's like one of a kind and so far out.
Well, so I did steal the idea from the Surgery Center of Oklahoma. I'll give them props. I heard about them in a podcast in the mid-2010s. And in the late 2000s, this group of anesthesiologists that had a surgery center in Oklahoma City said, "We're sick of the way that medicine works. Nobody likes it. And that's what we're going to do." And so you go to their website, they got a stick figure man, and you just click on what part of your body needs surgery, and they give you some options and they tell you a price. And they have a little bit of oral surgery, but as far as I know, we're the only oral surgery practice that does that. I know in Texas, I think I saw one in Washington State that's starting to do it.
What are you seeing in your patients when they come in and they already have the financial burden question answered? That's already out of the way.
I don't have to sell anything. It's sold before you come in. Yeah. I don't have a finance team. I don't have a sales team or a sales team. I don't have a marketing team either. But a lot of places, like for dental implants, that's a high end thing. You see all these dental implant centers.
Yeah.
You go to one of those places, the first person you meet with is the salesperson. They don't call them a salesperson. They call them like a patient coordinator or something. They're a salesperson.
Yeah.
And you're going to spend a lot of time in there, and they're going to start talking about finance. They're going to offer you like 3 different ways to finance this. And you're going to meet with the doctor very briefly, and that's it. And it's like going to buy a car. Come to our office, you call us and say, "I want dental implants." We tell you how much it costs. And if you show up, you've already kind of said like, okay.
Yeah.
What
a clean way to do things. I can't even... Just because of the past month with the medical stuff.
Oh, yeah. You're going to keep getting bills for months.
I'm like, dude.
The surprise bills are insane.
Dude, hey, by the way, I need $2,200 the morning of surgery.
Yeah.
I'm showing up with no clothes.
Right.
Comfortable. By the way.
Right.
I'm like,
I hate all that. I hate it. And there are better ways. And man, and there's a law out there about the hospitals have to publish prices and stuff. And
yeah.
If you can find that website, it's so convoluted, you won't understand it. I'll understand it because I know what the codes mean.
Yeah.
But you're not going to be able to figure out what it costs to have your hernia fixed.
Yeah.
But imagine, somebody just tells you, "Yeah, we'll do everything for $3,500. And you go, "That's it?" Yeah. $3,500, you're done. Bye.
Does River City Oral Surgery offer any type of financing?
So not in-house, but we have some third-party finance companies that we work with.
Yeah.
I tried really hard to get my local banker to help me with that, but there's just no collateral. So it's a high-risk loan.
Yeah, we're going to pull out that gold too.
Yeah. Your teeth, we need them back.
I wish that, we're the same age, and we've probably both done pretty well at business, and it still doesn't leave a big enough pile of cash to, think about if you had $3 million of medical stuff financed. It's just like if we could do that on our own.
Yeah.
It's crazy.
Yeah. You can't, if you think like I'll self-insure and there's things people do, but what happens if you get cancer in your car wreck and you get that $3 million bill? What are you going to do?
Well, I always think I'm talking about financing, like if you were financing for your patients. Mm-hmm. I used to always do this in landscaping. I would outwork my receivables because I've done a $30,000 job, $50,000 job, $80,000 job, and now I'm waiting to get paid. So then I'd have to do a project at my house and chill out.
My accounts receivable are negative.
They are. Damn, you got a good office manager.
Well, it's because nobody gets surgery without paying. And we make people prepay for big surgeries 2 weeks in advance. So I owe people money until they have surgery.
That helps you sleep at night.
Yeah. Because the traditional medical insurance or medical practice, dental practice that deals with insurance, ARs are 180 days and stuff. It's insane.
Dude.
Mine are negative.
You're probably one of the very few private practice doctors that has a negative accounts receivable.
I am sure. Yeah.
And I saw the fancy truck that you pulled up in. You're not making payments on that.
No.
I love driving. Well, your truck's not shitty. But I don't have preconceived notions, but I pull up and, I drive a 2011 Kia in Lubbock. I drive these old beater cars and I love it.
Oh, man. And I'm a car guy. I like cars. I like to work on a car. I like to turn a wrench. And I think that's part of what I like about the old ones is I want to go out there and mess with it,
Yeah.
Yeah. No, not spending the money on the cars.
Yeah. New trucks are out of this world expensive.
Yeah. The equivalent truck would be $100,000 truck.
Easily.
No thanks. Yeah.
Well, what else are y'all doing in your business that you're proud of that you set up that's different?
Man, the money is the big thing. It's what people talk about all the time when they come see us because they've gotten just stupid high quotes somewhere else and they can't afford it. And then we just make it so easy and plain. And I'm not going to get another bill. No. What if it's harder than you thought? I don't care.
Dang.
So that goes a long ways. And then just, like I said earlier, just kind of fixing stuff that people were told they couldn't get fixed or wasn't going to be any better. I think it's interesting. I was listening to some of your podcasts and recently you've been talking to some guys about growing and I think from what I've seen, I think all small businesses get stuck at this point where it's how do you go from the guy to not being needed for everything and growing your business and handing stuff off,
Yeah.
And we're kind of in that phase right now. Man, I lost my train of thought. Where was I going on that?
Well, you're talking about growing, not being the guy, because you are the guy.
Yeah.
And when you had mentioned that I bought an office that's this size, now I could use some extra rooms. I'm going, well, where's his new surgeon?
Well, so and I'm thinking about that. I know what I was thinking is, what I decided is I got to think. I would love to think that everybody just wants to see Dr. Haverkorn.
Yeah.
But probably not. There's something that I do that they like. What is it and how do I grow it? And how do I show other guys, like if I bring in that other surgeon, they don't need to be Mark Haverkorn, but they need to know what is the secret to our success.
Yeah.
I know that with the businesses.
Well, it's a tough thing. And again, I was having that conversation with Colby Jubinville the other day because I'm at a point, and when we talk about growth as a business, whether you're Mark's business that what do y'all have 10 people in there, 15.
Yeah, it's 7.
So there's 7 of y'all, and I have 300 employees. So, but your growth stresses are no different than mine.
No,
they're none.
Absolutely.
And it could be from going from 1 employee, you, to 2. That growth and that stress in adding another employee and to figure it out is, it's a challenge.
Yeah. And like, how do you know when it's time to add another employee? You know, because you get too many and things kind of slow down and you don't have enough, it's a problem. And all those things for sure, man. And then in the service industry, that's sometimes it's trying to duplicate yourself. You know, if you're selling something, if you're in retail or manufacturing, like nobody cares who made it. They just want the thing, you know. Retail may be a little different, but in the service industry, so many times the founding guy becomes the face of the company. And then everybody's like, I want to see Dr. Haverkorn, not the new guy. Yeah. And so it's like, we got to figure out how to fix that.
Well, I saw a lot of that in the lawn business.
Sure.
I thought, and I also now believe that a lot of that is in our own head. Yes. So they do want to know that Mark Haverkorn's expectations and standards are being met.
Yeah.
But they might not need Mark Haverkorn to remove those wisdom teeth. Yep. And I felt so strongly that Miss Jones wanted Tommy to come mow the grass. And I think a lot of it, did that happen? A very small percentage. And if I think about it now, I don't know if it ever even came up, but it might have.
Sure.
But I think it was more, we're our own worst enemy.
I totally agree with that. That's what I'm thinking about lately.
Yeah, I think you're being your own worst enemy on this one. If you have a clean cut, coworker that's coming in with a positive attitude.
Yeah.
You know what? We're putting you to sleep anyway, Miss Jones.
Right. You're not going to know. Yeah. They're vetted. I can trust them.
What have you done professionally to advance your business knowledge? Because you are a specialist on the face. So what have you had to do to get yourself moving forward as a business guy?
Yeah. So I've heard you kind of talk about business coaching and, man, and talk about being your own worst enemy. I'm the guy that's like, I got to figure this out. I'm not paying somebody. So I haven't done that yet. But I listen to business podcasts and I read books, know, and just that's where I'm learning. Yeah. And then these conversations, just, you don't have to be a surgeon for me to learn about business from you, hear your story.
I like, that's why, like I told you when you came in, I just love to hear business guys' stories, whether they're MDs or PhDs or CEOs. But a business coach, from my experience, they might not have done what you have did, but they know the structures and they know what's supposed to happen.
Yeah.
And the other thing is you attach people to these and stuff kind of gets squirmy.
Right, yeah.
But they know what boxes they should go in and what has worked.
Yeah.
So, and that was my conversation two days ago, because we had a party with one of our restaurants that we bought, and then we moved good managers. We just basically split your practice in half and opened another one.
Okay.
And then I watched the balls drop. And I was like, oh, shit.
Yeah. Yeah.
But I can tell you what's happening at the new one that we bought. I checked the numbers this morning. We've beat their record. I already beat it 3 weeks ago. I've only had it 2 months ago. And we're beating their sales record every single day.
How? What did you do different?
Well, good question. They...
See, these are the stories I like to hear.
Well, that's a good question. But I went into, I'm talking about Beach Lodge, which is a restaurant and hotel on the beach in Port Aransas.
Nice.
That I was lucky enough to get. But when I went in, your first thought as a restaurant guy is, okay, where does the bulk of this, engine come from? The kitchen.
Yeah.
Right?
Yeah.
Well, we're seeing 1.5-hour ticket times. We're seeing
no bueno.
I don't even know how to compare what I was seeing coming out of the kitchen to what you would see in someone's mouth or face. But you know what a pizza looks like.
Sure.
This pizza was coming out looking like we had put pizza on a flat piece of leather. And I'm like, wow.
Yeah.
This is rough. So we brought in some new folks to the kitchen, some other folks from Lubbock. Our ticket times yesterday were 26 minutes on a record day.
Great, man.
On a record day.
It's way down. Yeah.
Yeah. And motivation in the kitchen, watching, making sure pizza's okay. We're not going to use that. We're going to use a wood-fired pizza. It is a frozen pizza dough there. Yeah. We make our own dough every morning at Seafood and Spaghetti Works. But I'm not going for, they're different places.
Yeah, I got you.
So we got the kitchen rocking. And then I thought, well, the wait staff's fine, right? That's just what you would think. Front office staff is fine.
Right.
Let's go check it out. So I go check it out.
Like
and
a
I'm
secret
going,
shopper thing?
No.
Oh, okay.
I was just, I was paying attention to so many other things. There's a lot of stuff that goes on in a practice and a lot at a restaurant. So I go, well, what's going on with the wait staff? Holy shit.
Not great.
I'm sitting there at dinner and I watch 3 different servers come up to one table and go, have you been helped? Have you been helped? I'm going, oh my gosh. Y'all don't have sections?
Yeah.
No. So what?
I've waited tables. I know that.
Yeah. Why don't you have section? Oh, no, because we like it this way. I go, no. So I went in the next morning, drew a seating chart. And then, of course, change is tough for anybody.
Sure. Yes.
Even if you're doing shit the wrong way, change is tough.
Yes.
And, but where there's no pain, there's no change. Well, I saw the pain. I'm going, y'all are killing customers. Mark doesn't want to hear you come up 3 times and ask, have you been helped?
Yeah.
Have you been helped?
Does anybody talk to each other here at this place?
What would make it blatantly obvious that we suck? 3 waitresses came up to me.
That's funny.
So we put them into sections and got it's been a party.
Man, I didn't know restaurants operated without sections.
This one did.
Apparently they do.
This one did.
Okay.
But we dropped the ball on. We pulled a good manager out of Beer House in Port A and moved him over there. And so Beer House customer service dropped down a little bit, and that's been kind of I call stress lodge. I call a beach lodge a stress lodge.
Yeah.
And but that's been kind of my stressor lately is those 2 things.
Okay.
But the comparison that I would make it for any other business, guys, this is no different than when you have a stress point with your 7 employees. It's no different. It's a huge mound for you, and it's a big mound for me. So we're all going through the same shit, whether we have 2 employees or 200.
I didn't realize when I got into business just how hard it is or what a stress point it is to bring in a new person. The hiring process and getting the right person, getting them trained, how much effort that takes and consequently cost to the business.
Yeah.
I just didn't even really realize that.
Well, let me throw another little curveball at you that I didn't realize. What is the sexuality of your office, males or females?
All women.
Okay.
And I got 5 daughters and a wife at home.
So you just do what you're told.
Well, so my staff and my office manager would say I did too much micromanaging, like all the new guys, all the small business guys. And so I'm learning to I want you to tell me what to do, not the other way around.
Well, I worked with all guys in the lawn business for 20 years.
Yeah.
So I didn't have...
You didn't know how to talk to the girls.
No, the girls and the cattiness and what happens with them in an office in an environment is a whole nother like a stressor to hiring.
If you looked at my phone and my text threads with my male buddies, the stuff that we say to each other would destroy my office in about 1 hour.
I know.
You know, because you're just like, listen, you retard.
Yeah.
You know, you can't do that.
No.
But
these are just interesting points that you would never even think of until you've seen it.
Yeah.
And I like that you and I are the same age. Yeah. And so it's kind of like just carried on within a year. And it's a crazy thing. Would you change anything about what you've done in this career path, or what would be something you changed?
Man. Well, it would be great to have been settled earlier in my career, but that's okay. That doesn't really matter much. And I really like what I'm doing. I'm at peace about the business model. It used to stress me out in a traditional practice that uses insurance. Patients would ask me, you know, well, how much is this going to cost? And I'm like, I don't know.
But you didn't know.
No, but it drove me mad.
Yeah.
And then I would see that one person would get their wisdom teeth out for $3,000 and somebody else would pay $600 out of pocket, and it all depended on their insurance, and that $3,000 might be with insurance.
Yeah.
You know, and like drove me nuts that just nothing was the same. So I'm very happy about that. I probably don't make as much as other oral surgeons do.
Yeah.
But I'm fine.
I think there's a number that you get to where that doesn't really make that big of a difference. Like your lifestyle's not going to be
I'm
different.
not going to be Elon Musk.
Yeah.
But I'm going to be fine.
Yeah. What advice would you give your 20-year-old self?
Oh man, that's a good question. What would I do? Oh, gosh. I think, man, there's plenty there. Plenty of personal advice. I'm thinking business advice. You know?
This is business under fire.
Yeah.
Not your personal business under fire.
Yeah. Man, I think probably read more business stuff, just learn more of the business. You know, I was so into the surgery and the science and all that, but just more of the business. And I used to also just be rougher around the edges. You know, like when I was a resident, we would do our evals, and they'd be like, "Well, you're a good surgeon, but you know, sometimes you're a little bit gruff or whatever." You know, bedside manner stuff. You know,
I think that's maturing.
Yeah,
I know I was a dick until I was like 19.
Yeah,
and then I gotta apologize to people later in life. It's like, why?
Yeah. Why? Yeah, you're trying to kind of prove, young guys, we're all trying to kind of prove ourselves, and get out from under your parents and all that. And so I would probably some of that. Being a male is tough, but I guess you have 5 daughters. Yes. Golly, I only have 1. Yeah. And that's tough. Man, we've not had much drama so far. My oldest one's 16. They're not quite, there's still plenty of time for escapades, but so far it's been okay. Well, mine's been behaving too, but it's just all the girl stuff that they go through. Yeah. It's tough. And I think it's tougher now with all the social media and this and that. And remember, you had to wear it. Well, you were going to math competitions, so you didn't care what shirt you were wearing. I just had a pocket for my pocket protector. Yeah. But high school is just tough. Oh, yeah. Period. Yeah. So I, 2 things there. I went to college when I was 16, so I didn't actually finish high school. Holy crap. So I was the huge nerd in high school, right? And I started to kind of get in shape and stuff right before I left, and that started to change a little bit. But then you show up at college, you can be anything you want to be. I know. So I can just leave that all behind me. Yeah. And then people are like, don't you miss high school? And I was like, okay, you were in high school. I was in college with my parents 300 miles away. What do you think? Your point of leaving all that behind, high school was a big deal. And if anybody's in high school that listens, I tell these people is high school is a big deal. Everything mattered every day, what you're wearing. Yeah. But the day you walk out of that high school, none of it matters. None. I'm not in touch with anybody from high school. Yeah. At college, yes, but just not in high school. We've got an intruder in here. Uh-oh. And he, he's been lucky. I think we've had 2 people in the live studio audience here, and Dad's been to like 3 podcasts.
So he made it. I didn't tell him. I don't know if I told him we're going to Burnt Bean or not, but he's got a nose like a bloodhound. So my dad just walked in the podcast studio. We were about wrapping it up anyway.
So I got to give a little props to your dad.
Go for it.
Because he helped me. So this is part of the business story, you know. Before COVID happened, the practice is about a year old. And, we're doing this interesting new business model. So I joined the Free Market Medical Association. There's a local chapter in San Antonio. And the San Antonio Express News did a little piece on us, you know. They're just trying to get somebody to read a newspaper.
Yeah.
Which doesn't happen. Except for your dad, he takes the paper.
Yeah.
So he saw that article, came to the office and said hello, and then that's how we met, and we've been talking ever since. And your dad is my number one salesman.
Oh yeah, he's good at that.
Yeah. So he goes around and spreads the word.
Well, he does, but he's been in the dental business forever.
Yeah.
And he's seen what you do at your practice and is just so proud of it and loves how you work. But what you're doing with your practice is completely different from what people are normally doing. And it's a relaxing, I would love to know what my wisdom teeth cost to get removed.
Yeah.
And you cannot get that answer.
No, your surgeon doesn't know what that hernia cost. Ask him, what do you charge to fix a hernia? Yeah. And he's going to look at you what do you, you're an idiot for asking that.
I know. And so my dad's been your number one proponent and fan because of how he's seen your patients get treated in the office, the quality of medical service that you provide. And he just, he's your cheerleader.
Man, I love it. Thank you.
So, and he's a good dentist too. Yes. I have people, he's retired now. So I have other people inspect my mouth, and I have literally had people go, who did this work?
Oh, wow.
They're like, it is perfect.
It's quite a
compliment. And so it's nice. I hope these teeth stay in so I can brag about them till I die.
So, one way that I'll kind of decide about a new dentist is when I put in an implant, I don't put the crown on top. The dentists do. How much back and forth is there with this new guy on getting the crown in? And I can send something to your dad, and I never hear back. I just tell him, it's this size and it's that, and he goes, okay, got it. That's all, So that's smooth.
Well, he might have to put the last one on my daughter. That's what I was going to tell you. Her tooth got knocked out.
Oh, man.
And she was maybe 8.
Okay.
My son and her were running, and she fell and knocked out her tooth, which for anybody that doesn't know, Dr. Haverkorn, if a tooth gets knocked out, root structure is still there.
Yeah, got the whole tooth.
What do they do?
Put it in milk and call your dentist.
Okay. That's what we did. But don't
go to the ER. Okay, people do that.
Yeah.
A good ER doctor will put it back in, but a lot of them don't know what to do, and then they're calling you and you're wasting time. So hopefully you got a dentist you can call.
So go to the emergency dentist.
We'll call your dentist, hopefully, if it's during normal hours. But even if it's after hours, if you got an established relationship, they might help you,
Good. Well, so Kylie, I guess you have to wait until you're 18.
Yes.
Should we wait longer?
No, that's fine. A lot of girls are done growing at 15, honestly. So 18's safe. Boys sometimes get a second growth spurt in college. So, you get them to they're 21 maybe sometimes. Yeah. But 18 should be totally fine for her.
And then what do we tell? She still has the original tooth in there. Oh, nice. And it's not too discolored, but...
Oh, they put it back in?
Yeah, but it's on a retainer on the back.
Okay, I got you. Okay.
They tried to put it in, but it didn't take.
Yeah.
So what is that process going to look like for old Kylie B, my daughter, on her implant?
Yeah, well, so... You got to look at the foundation first, so you got to have good bone. An implant's just a screw in the bone. It looks like a little machine screw, but you got to have enough bone to fit all the way around the implant. So we got to look at how much bone we got, and then you want the kind of the window dressing, the gums to look right too. So sometimes you got to thicken those up, not always. So get the bone right, get the gums right, put the implant in. Sometimes you can kind of combine some of those surgeries. Yeah, and then those implants need about 3 months to heal, and then you get the crown on them.
How many millions does that cost on your end?
So if all I got to do is put the implant in, it's $1,600.
Cool.
And then the crowns, They kind of vary, but I would say anticipate around like 12 to 1,500.
Yeah. Well, it'll be coming up because she's 17 and be 18 in March.
Man, grow up fast.
What was the other? I got one. The other question going into left field is, I think by the time you finished your first math competition, you were successful. But and obviously getting through all the schooling that you have done is successful. But what is your definition of success these days?
Oh man, you know what? Right now it is my kids. You know, what kind of people are they going to be? Mm-hmm. You know, we talked a little bit about that, and I think as a girl dad, part of my job is to teach them about boys that they don't understand.
Yeah.
You know, and I'm not just talking about like the birds and the bees. I'm talking about just guys don't think like you.
Yeah.
You know, and you don't think like guys. And let me help you understand this. So, yeah.
I've got a buddy named Cisco Leonares that outdid you by one girl. He has six girls.
Dang.
But 5 are his.
Yeah.
And then he goes, I couldn't even adopt a boy. So between you and Cisco, y'all could sit in counseling for girl dads.
A boy at this point would be a nightmare. Like, I don't know what to do.
No.
You know, I got the girls.
Have your wife do a vasectomy at night. She can fix you up. That's too hilarious. Deep, but I might or might not have had one of those. And the doctor's going, you're just doing great. And I'm sweating about to pass out.
So this is a business idea I have that I've tried to do with my wife, and she hasn't signed off on it. But I'm like, look, hon, you can have one of my rooms and you can do vasectomies, and I'll sedate them. I won't even knock them all the way out. I'll just give them a little bit of Versed, $500, and they feel like they're about 4 drinks in.
Yes.
And it would be so much better.
It would be great.
She just doesn't want to do it, but I'm like, come on,
honey. Just get in there and give me like 4 of them a day.
Yeah.
Part-time job. What do you do for your part-time job? I'm saving the world from idiots. So, well, anyway, great, are you hungry or no?
Yeah, burnt bean, man. I've heard all about it.
Well, we're going to go to burnt bean, and I really do appreciate you reaching out. Dad has been trying to get you to come in here for a while, and I didn't know what we were expecting or not, but it's been my pleasure and been a really good time.
Oh, it's been my pleasure. I've enjoyed this.
Where can people find River City Oral Surgery at?
So it's River City OMS, OscarMarySam.com.
Cool.
Everything's there.
Well, thanks for coming out, and we look forward to watching you work and grow.
Thank you.
Thanks for watching Business Under Fire. We'd love it if you would share, like, and subscribe. See you next time.